You're watching WION World is One, and we have some breaking news that is coming in on this broadcast. India has reported its second COVID-19 death. That's the story that's breaking here on WION World is One. A 69-year-old resident of capital New Delhi has succumbed to the infection. This is the second death that is being reported in India. We have our principal diplomatic correspondent, Siddhant Sibal, now joining us on the phone line with more details. Siddhant, over 80 cases and now the second death in India.
Well, yes, sir, the second death has been confirmed in India, and the death has been confirmed in India's national capital, Delhi. The lady, 68-year-old lady, was from West Delhi, and she was in contact with one positive case. Her son was the person, and her son had traveled to Switzerland and Italy in February, and thereafter, when he came back, both the mother and the son were admitted to the Ram Manohar Lohia hospital, where it was confirmed that both of them had COVID-19, and thereafter it has been confirmed by the government here in Delhi that she has died. Of course, comorbidity means that because of COVID-19, her situation deteriorated. She already was a patient of diabetes and hypertension, and that led to her death. But this is something of a dangerous situation, or something that can create panic, because we know that only yesterday night, around this time only, India confirmed the first death in the southern state of Karnataka. We know India has put in place a lot of provisions, including no visas to anyone coming to India till 15th of April. This came into effect today itself, and this will continue till 15th April. We also know that India is in the process of evacuating its citizens from Italy and Iran. In fact, a flight from Iran is going to come back in just few hours from now. Mahan Airways will be coming and bringing back Indians, and then there is another Air India flight which is kept as ready, which will be going to Iran to fetch more Indians. Also, India is going to send a plane, Air India plane, tomorrow to Milan in Italy, and will be getting back around 200 Indians. But largely, we know that the provisions taken by the government, in fact, masks have been put as an essential commodity under the Essentials Commodity Act, which basically means that the government will now take care of all the masks and their production.
Siddhant Sibal, our correspondent, reporting on the latest on the COVID-19 outbreak in India. Now we have Dr. Manoj Goyal, Director and Head of Department Pulmonology at Fortis Hospital, joining us on the phone line. Dr. Manoj Goyal, thank you so much for taking time out to be with us here on the broadcast. India has now confirmed the second death due to COVID-19.
Yes.
The question is, at this stage, what do you think is the need of the hour for all those watching this broadcast? We have over 80 confirmed cases in the country, and now the second death. What is the need of the hour?
See, the need of the hour is that we have to step up our, precautionary measures as an individual, and the country has taken the major steps. I mean, we had only 80 cases, but government has been very, very proactive, has taken all kinds of steps, self-isolating. So the India has self-isolated from rest of the world. Similarly, we also have to self-isolate if we have got symptoms of cough, fever, or breathlessness, and if we have got a history of, travel or contact with a known case of coronavirus. So that becomes very important. Secondly, other precautionary measures which are very simple and routine, that you do not touch your eyes, do not touch your mouth or, the face without washing your hands. Do not shake hands with others, and try not to, cough and manage your cough etiquette properly, in the routine practice. So this becomes very, very important at this point of time. So we don't have to panic, because, it has its volume of, patients who are going to die around 2 to 3%. So that's going to happen. But it's going to be a mild disease in more than 85% of the patients. So that's why we don't have to panic. But again, we have to step up all precautionary measures, because that is the way forward now.
Dr. Manoj Goyal, Director and Head of Department Pulmonology, Fortis Hospital, joining us on the phone line and sharing his perspective. Dr. Goyal, there have been many ways in which people can secure themselves, but we are talking about keeping your hands clean, keeping your phones clean. Some say that our mobile phones are the greatest carrier, can be the greatest carrier of the virus.
Absolutely. I mean, that's why, you have to keep touching, you will keep touching these articles because they are the objects of your common use. But at the same time, you have to keep washing your hands and avoid touching your face, nose and eyes. That's very, very important. Every time you get an opportunity, always keep washing your hands. That's the only way to protect yourself.
Right, and as we speak, we do know that India is screening all passengers who are arriving in the airports across the country. But in the meanwhile, how can communities and societies and private individuals make sure that they are adequately safeguarded against the virus?
See, I think the kind of measures the government has taken, I do not think, this virus is going to, spread in the community as it has happened in other parts of the world. Because we don't have as yet a cluster, a very specific cluster from where the infection is spreading, where a person who has not traveled abroad. So it's only the people who have traveled abroad have come to the country, and from there the infection has spread and they have been effectively quarantined. So I really personally feel that there won't be a good, a big epidemic that we are going to face. But at the same time, we have to prepare. And preparedness is mainly precautions that I have been talking about. And, the media, the government, the Prime Minister says no to panic and yes to precautions. So that is the way forward, actually.
Dr. Manoj Goyal, Director and Head of Department Pulmonology, Fortis Hospital, joining us on the phone and with that perspective. Thank you so much, Doctor, for being this here on the broadcast on WION World is One, even as we continue to bring you the latest updates on the COVID-19 outbreak in India. 69-year-old from Delhi is the second death that's being reported due to COVID-19. Siddhant Sibal, our correspondent, is still with us with those details. Siddhant, we've heard out the doctor. There is absolutely no need to panic, but what is important is to take cognizance of the fact that we have over 80 cases. Now the second death has been reported, and it's again following a similar pattern. It's again people above the age of 68 who are becoming the fatalities.
Known that people who are aged are more impacted by this virus. In fact, less cases have been reported in children and more cases have been reported in elderly. And of course, the body is also not ready as well. So that is why we have been seeing that all the cases, that is the two cases which we have seen yesterday in Karnataka and today in Delhi, both the people were aged. Yesterday, Karnataka case was 30 years old, was 70 years old, and today's case is 68 years old. And that is why it has impacted them. But by and large, what the government has been focusing on is on awareness to make sure that people know that washing hands is something very simple, and that can help in a long way when it comes to preventing the entire crisis. But largely we have seen that the government here put in place all the provisions since 8th of January, long before people woke up globally about this crisis. In fact, India had taken measures like when it comes to people coming from China being screened very early on, and since then we have seen just measures being increased. In fact, today India announced the suspending of the India-Bangladesh bus and train services, and also at the land borders now nobody can come inside. There are specific designated points. Rest all the land borders when it comes to Nepal, Bhutan, Myanmar, Bangladesh have been closed down. Also, the government is focusing on making sure that people are aware about the risk, and also there is no panic as well, because the other thing the government is trying to fight, to use the word, is to make sure that people are not panicking about it. We know that how the global stories, how the global narrative is shaping out. We have been seeing how people leave countries have been reporting the cases. In fact, today the Australian Home Minister was confirmed with the virus. The wife of the Prime Minister of Canada is confirmed with the virus. There are reports about the Brazilian president as well. So these are the cases which create more panic among the public. But the message from Delhi is that do not panic. Just if you think so that you are having fever or you're coughing, you can self-quarantine. And to also send a message that the mortality rate is very less. It's just 2 to 3%. So people can recover from the disease itself.
Siddhant Sibal reporting live from India's capital, New Delhi, as it confirms the second death due to COVID-19.